2 weeks from today, you walk into your kitchen, wrap the cuff around your arm, press the button on your monitor, and the number that comes up is the lowest you've seen in a long time. You didn't switch pills. You didn't suddenly start jogging at sunrise. You didn't do anything dramatic. You just made 7 small, very specific changes to what you put in your body every day. Changes that work on the parts of your biology your prescription was never designed to touch. My name is Dr. Zion Adetola. For more than 2 decades, I've worked with people over 50, and I've lost count of how many times I've watched a patient walk back into their cardiologist's office and be told, "Your numbers look so good, we're going to lower your dose." Not because they begged, not because they argued, because the readings on the chart left the doctor with no other conclusion. Today, I want to walk you through exactly what those patients were doing differently. But before we get into the 7 foods, I have to warn you about something. Somewhere around the middle of this video, I'm going to name 3 things, almost certainly sitting in your house right now, that are quietly working against every tablet you swallow and every healthy choice you make. And here's the uncomfortable truth. If you skip past that part, these 7 foods will give you maybe a third of what they are actually capable of. So stick with me to the end. The second half of this video might honestly be the most useful health information you'll hear all year. Let me start with a bit of biology your doctor probably never sat down and explained. Inside the walls of your arteries, your body produces a gas called nitric oxide. Think of it as your body's built-in pressure release valve. It's a tiny signaling molecule that tells the muscle tissue wrapped around your blood vessels to loosen up and open wider. When those walls relax, blood moves through more easily, and your pressure drops. Here's the problem. After around age 50, your body's production of nitric oxide quietly starts falling off a cliff. And almost every standard approach to blood pressure, including most medications, doesn't fix that decline. They manage what's happening downstream. They don't rebuild what's broken upstream. The 7 foods I'm about to walk you through all touch this pathway in one way or another. Some of them deliver the raw materials your body needs to produce nitric oxide. Some of them protect the nitric oxide you already have from being destroyed. And one of them actually switches on the internal factory that manufactures it from scratch. Let's go through them one at a time. Number 1, beet juice. Beets are basically nature's champion when it comes to something called dietary nitrates. When you drink a glass of beet juice, those nitrates travel up to your mouth, where certain bacteria living on your tongue convert them into nitrite. That nitrite then slips into your bloodstream and gets converted into active nitric oxide. Your arteries literally exhale and open up. A study published in the journal Hypertension found that drinking about 250 milliliters of beet juice, roughly a small glass, dropped systolic blood pressure by around 8 points within hours. Here's how to actually do it. Every morning, drink 1 small glass and listen carefully. Keep it at room temperature. Cold beet juice slows down the bacterial conversion happening in your mouth. If the taste feels too earthy, cut it with a splash of apple juice. Give it at least 2 weeks before you judge it. Now here's something most people don't know. Beet juice hogs all the attention in this category. But there's another food that actually packs more dietary nitrates per gram, and most people stroll right past it in the produce aisle. Number 2, arugula. It works through the same nitrate pathway as beets, but arugula brings something to the table that beets don't have in the same quantity: potassium. And potassium matters enormously here. It tells your kidneys to flush sodium out instead of holding on to it. When sodium builds up in your body, it drags water into your bloodstream, which increases the total volume of blood your heart is pushing around. More volume means more pressure. Simple as that. Potassium is the natural counterweight to all that sodium, and most people over 50 are walking around quietly deficient in it without realizing. So here's what to do. Add 2 big handfuls of fresh arugula to 1 meal a day. A quick salad with olive oil and lemon juice is perfect. But here's the catch. Don't cook it. Heat wipes out both the nitrates and the potassium benefit. Raw is non-negotiable. Number 3, hibiscus tea. Let me ask you something most people would never think to ask their cardiologist. What if there was a tea that worked through the exact same biological mechanism as one of the most widely prescribed blood pressure drugs in the world? Not something close to it, not a watered down version, the exact same mechanism. Well, there is. And it grows as a flower. Hibiscus contains compounds called anthocyanins, along with certain organic acids that block an enzyme called angiotensin converting enzyme, ACE for short. The entire class of drugs called ACE inhibitors works by doing the same thing. They stop your body from producing angiotensin II, a hormone that squeezes your blood vessels tight. Hibiscus does it naturally. A meta-analysis looking at over 500 patients found that regular hibiscus consumption brought systolic blood pressure down by about 7.5 points on average. Here's the protocol. Steep 2 teaspoons of dried hibiscus flowers in a cup of hot water, about 240 milliliters, for 8 to 10 minutes. Drink 1 or 2 cups a day. One important note. If you're already taking ACE inhibitors, talk to your doctor before adding hibiscus regularly. The combination can push your pressure down further than you want. I'm not saying avoid it. I'm saying your doctor should know you're drinking it. Number 4, raw garlic. And this is the one almost everyone has heard of. And almost everyone is using wrong. The mistake comes down to timing. When you crush or chop a garlic clove, you trigger a chemical reaction. An enzyme inside called alliinase converts a compound called allicin into allicin. Allicin is responsible for most of garlic's cardiovascular power. But here's where it gets really interesting. Once inside your body, allicin converts again, this time into hydrogen sulfide. And hydrogen sulfide, just like nitric oxide, is a gas that tells your blood vessels to open up. So you're getting 2 different vessel-relaxing gases working through 2 different pathways at the same time. That's what properly prepared raw garlic delivers. And here's the mistake. Most people crush the garlic and toss it straight into the hot pan. The heat destroys that alliinase enzyme within seconds. No enzyme, no allicin, no benefit. You get the flavor. You don't get the medicine. Here's what to do instead. Crush or finely chop 1 to 2 cloves. Then walk away for 10 minutes. That wait isn't optional. It's the chemistry finishing its work. After 10 minutes, use it. Stir it into a salad dressing. Spread it on avocado toast, whatever suits you. That one change, 10 minutes of patience, turns garlic from a seasoning into an actual therapy. Actually, let me ask you something before we keep going. Do you eat garlic regularly? And when you cook with it, do you throw it straight into the pan or do you wait? Drop a word or 2 in the comments. I'm genuinely curious how many of you have been doing this right without even knowing why. And how many of you have been throwing away most of the benefit every single day. Number 5, ground flaxseed. This one has the strongest long-term clinical data of anything we are covering today. And I want to be precise about what the research actually shows. A randomized controlled trial published in Hypertension followed patients over 6 months. One group added ground flaxseed to their daily routine. The other group didn't. At the end of 6 months, the flaxseed group showed an average drop in systolic blood pressure of 15 points. 15 points, sustained. That's comparable to some first-line blood pressure drugs. And the mechanism isn't just one thing. It's several things working in parallel. Flaxseed is packed with alpha-linolenic acid, an omega-3 that calms inflammation inside your arteries. It contains lignans, plant compounds that influence hormonal pathways tied to vascular regulation. And it's loaded with soluble fiber that feeds the gut bacteria involved in cardiovascular health. The protocol is 2 tablespoons of ground flaxseed daily. The word ground is critical. Whole flaxseed passes straight through you. Your body simply can't break the shell. You need it ground. Sprinkle it onto yogurt, stir it into oatmeal, blend it into a smoothie. The taste is mild. Most people don't even notice it. The catch: you need 3 to 4 months of consistency before you see the full payoff. This isn't a quick fix. This is biology working at the cellular level over time. But here's the thing, 3 months is going to pass either way. The question is just whether you'll have something to show for it. Number 6, dark chocolate, at least 85% cacao. I already know this one will raise eyebrows. So let me give you the mechanism before the conclusion. So the skepticism has a place to land. Cacao is one of the richest food sources of compounds called flavonoids, specifically a subgroup called flavanols. These flavanols switch on an enzyme called endothelial nitric oxide synthase. That's the enzyme your artery walls use to manufacture nitric oxide from scratch, starting from an amino acid called arginine. So think about what's happening here. With beet juice and arugula, we are feeding in the raw materials through the nitrate pathway. With dark chocolate, we are flipping on the internal factory that builds nitric oxide by a completely separate route. A meta-analysis pulling from 24 clinical trials found that regular consumption of high flavanol chocolate produced measurable drops in both systolic and diastolic blood pressure across different populations. The protocol is 20 to 30 grams of dark chocolate a day, minimum 85% cacao. The higher the percentage, the more flavanols and the less sugar. This is not a green light to eat the whole bar. We are talking 3 to 4 small squares. That's the therapeutic dose. That's what the research is actually supporting. Number 7, pomegranate juice. This one works differently from everything else we've talked about. The first 6 foods either produce nitric oxide or help your body make it. This one protects the nitric oxide you're already making from being destroyed before it can do its job. Here's the problem. Nitric oxide is fragile. Free radicals, the kind produced by inflammation, oxidative stress, poor sleep, and processed food, will shred nitric oxide before it ever reaches your artery walls. You could be drinking beet juice at breakfast, eating arugula at lunch, and nibbling dark chocolate in the afternoon, and still have almost nothing happening. If your oxidative stress is high enough to destroy it faster than you can produce it. That's where pomegranate comes in. It contains some of the most powerful antioxidants in any food, including a compound called punicalagin that's essentially unique to this fruit. Research shows it's more effective than red wine or green tea at neutralizing the specific free radicals that destroy nitric oxide. A clinical trial published in Clinical Nutrition found that pomegranate juice lowered systolic blood pressure by about 5%, while simultaneously raising measurable nitric oxide in the bloodstream. Protocol: 150 milliliters of pure pomegranate juice a day. Look for something with no added sugar and no from concentrate on the label. Both of those slash the polyphenol content. Think of pomegranate as the shield that protects everything the other 6 foods are building. All right, now I need your full attention for this next section, because for a lot of people watching right now, none of what I just described will reach its full potential. Not because the foods don't work, but because 3 everyday things hiding in your routine are quietly dismantling the biology we just spent 15 minutes setting up. The first one is going to surprise you. Your mouthwash. I know how that sounds. Just stay with me for 30 seconds. Remember those bacteria on your tongue. The ones that convert dietary nitrates from beet juice and arugula into active nitric oxide. That whole process depends on specific bacterial species living in your mouth. Your oral microbiome. Antibacterial mouthwash. The kind that says kills 99.9% of germs on the label. Can't tell the difference between harmful bacteria and the helpful nitrate converting bacteria your heart literally depends on. It kills both. A study in Free Radical Biology and Medicine found that using antibacterial mouthwash twice a day dropped nitric oxide bioavailability by 25%. Think about what that actually means in practice. You drink your beet juice in the morning. You eat your arugula at lunch. Then you swish antibacterial mouthwash at night. And you've just wiped out a quarter of the benefit you worked all day to create. The fix isn't to stop brushing your teeth. Use a regular fluoride toothpaste. Brush thoroughly. If you want to use a mouthwash, pick one that's not antibacterial. Or just rinse with water after meals. Your mouth isn't a separate ecosystem from your cardiovascular system. It's part of it. The second saboteur is probably what most of you ate this morning. Cereal, orange juice, white toast with jam, a bagel with butter. These are refined carbohydrates, and they trigger a rapid spike in blood sugar. Your pancreas answers with a flood of insulin, but insulin does something to your kidneys that almost nobody gets told about. It signals them to hold on to sodium instead of flushing it out. Sodium retention means more blood volume. More blood volume means more pressure for your heart to push against. This is a big part of why blood pressure tends to spike hardest between 6 and 10 in the morning. It isn't just cortisol rhythms. It's what most people are eating for breakfast. The change: shift your morning meal toward protein and fat. Eggs with avocado. Greek yogurt with walnuts and a spoonful of ground flaxseed, which you're going to be eating now anyway. Smoked salmon with cucumber. Foods that digest slowly. Keep insulin low and let your kidneys stay in sodium excretion mode during the most dangerous hours of your day. Just that single change, just breakfast, can noticeably flatten your morning pressure peak. And that morning peak, as I'll explain in a moment, is the one that carries the most cardiovascular risk. Before I tell you the third one, let me ask you directly, what does your breakfast actually look like most mornings? Toast and coffee? Something different? Drop it in the comments below. I'm not asking to judge. I read these comments, and the patterns I see in those answers tell me a lot about where people need to start. The third saboteur is something most people would never connect to their blood pressure. Your painkillers, NSAIDs, ibuprofen, naproxen, high-dose aspirin, are among the most commonly used medications on the planet, especially in people over 50, dealing with bad knees, sore backs, stiff shoulders, or recurring headaches, and they interfere with blood pressure control through 2 different mechanisms. First, NSAIDs block prostaglandins, hormone-like compounds that help your kidneys flush sodium and keep blood vessels dilated. Block those, and your kidneys hang on to water and salt. Second, NSAIDs partially neutralize the pathway that several common blood pressure medications, including ACE inhibitors and diuretics, use to do their job. So think about that. You might be taking your prescription religiously, eating every one of the 7 foods I described, and then popping 2 ibuprofen on Tuesday afternoon for a sore knee, and partly undoing the whole system with a single pill. The alternative worth discussing with your doctor is acetaminophen for pain. When appropriate, it doesn't carry the same cardiovascular interference. And if you're on regular NSAIDs for chronic pain, please don't just stop them on your own after watching this video. That's not what I'm telling you to do. This is a conversation to bring up at your next appointment. Important, but not a solo decision. Now let me close the loop I opened at the very start of this video. Why the morning matters more than any other time of day. Between 6 and 10 in the morning, your body experiences a natural surge in cortisol and catecholamines, your stress hormones. That surge produces a sharp, predictable spike in blood pressure. Cardiologists have a name for it. They call it the morning surge. And more heart attacks and strokes happen in that 4-hour window than in any comparable stretch of the rest of the day. Your morning routine either feeds that surge or blunts it. The protocol I've walked you through today blunts it from multiple angles at the same time. Beet juice and garlic in the morning flood your system with vessel-relaxing compounds at exactly the moment your arteries are under the most strain. Shifting your breakfast away from refined carbs removes the insulin-sodium spiral that adds even more force to the surge. Dropping the antibacterial mouthwash protects the bacteria that turn your morning nitrates into active nitric oxide right before your pressure peaks. These aren't 7 tips to pick and choose from. They are one connected system designed to attack high blood pressure from several biological directions simultaneously. Your medication handles what's happening at the end of the line. This protocol handles what's happening at the beginning. The upstream mechanisms your prescription was never built to reach. If any of this made sense to you, there's a second layer that matters just as much. Specific mineral deficiencies, especially magnesium. Determine whether everything I just described works beautifully or barely works at all. I broke that down in another video. The link is in the description. If this gave you something useful today, hitting like takes 2 seconds and genuinely helps other people looking for this kind of information find it. Subscribe if you want the next piece of this protocol next week. And as always, run any dietary changes past your doctor, especially if you're already managing blood pressure with medication or have any underlying conditions. This information is meant to work alongside your medical care, not to replace it. I'll see you in the next one.